second jab for the 360,000 persons in the 43 districts in the Greater Accra, Ashanti and Central regions who received their first jabs from 1st to 9th March. I'm happy to announce that beginning Wednesday the 19th of May to Wednesday 26th May, the deployment of the second dose of vaccines will take place across the designated vaccination centers in the 43 districts, approximately 12 weeks after the first jab, as the science prescribes. More details of the deployment will be communicated by the Ghana Health Service in the coming week. Efforts are being made to ensure that those who receive their first jabs after the 9th of March will in due course receive their second. We are expecting an additional 300,000 doses of Sputnik 5 vaccines, which have already been approved by the Food and Drugs Authority to arrive in the country. As and when we make further progress in the acquisition of vaccines, the Ministries of Health and Information will make this known to you. We're making all efforts to achieve our overall vaccination target. As alluded to earlier, we are all aware of the havoc the virus is wreaking in Asia and South America, in the form of rising infections and huge death tolls. Whilst our thoughts and prayers are with these countries, we must be mindful of the associated risks of travel to and from these countries. At this time, I want to reiterate, as captured in the Travel Directive, passengers who have the virus and prevent them from introducing it into our population. Travel and ECOWAS biomass. All passengers traveling in Ghana must have test results or certificates bearing the trusted travel or biomass codes to be acceptable at KIA. We have reevaluated quality checks on testing at KIA, and we're satisfied with the sensitivity and specificity of the testing regime there. All arriving passengers who test positive will follow the laid-down procedure. Those who test negative from designated COVID-19 hotspots and testing negative at KIA may be subjected to a repeat test on the 3rd day of arrival. Our fight against the virus, my fellow Ghanaians, is by no means over. The continuous havoc being experienced by some countries as a result of the virus is a testament to the fact that until all countries have rid themselves of the virus and have achieved herd immunity, none is safe. So let us all continue to adhere to the COVID-19 safety protocols that are now part of our day-to-day activities. We see the rewards for our compliance with the protocols whenever we witness favorable scenarios in our fight against the virus, evidenced in the easing of some of the restrictions. I'm particularly happy that the significant investments we have made in ensuring compliance with the safety protocols have enabled us to open in safety all schools, private and public, at all levels. And I want to thank parents, teachers, and students for making them work. We have also put in place the necessary protocols that have allowed us to return to churches, mosques, workplaces, markets, stadia, and to travel. Our ability, however, to congregate in closed spaces like cinemas, theaters, and nightclubs remains restricted. In a move towards the reopening of cinemas and theaters, government has engaged cinema owners and operators on a set of protocols and guidelines that need to be put in place and implemented by all operators before eventual reopening. In the coming weeks, the Ghana Health Service and the Ghana Tourism Authority will be announcing these protocols and mandatory modalities and work with the operators on a set of directives that will ensure the health and safety of all patrons and staff in all the facilities involved. Fellow Ghanaians, I remain optimistic that we can return our lives to normal if we cooperate and work together. Let the reduced rate of infections not lull us into a false sense of security. Let us continue to adhere to the safety protocols, that is the enhanced hygiene and mask wearing protocols. Let us take the vaccine when it gets to our turn, and let us continue to put our faith in Almighty God. There is light at the end of the tunnel. Our goal of 0 active cases is in sight if we remain vigilant and steadfast. Enuanum, efiri na awotwe ayebe. Woni awo panye no. Bese awo nye tosu mienu. Aban eboa boadwo na no bebre. Ama Ghana fu nyina. Esramo sedi amaka dada. Moni bia eni panye no. Enti se edru so a kola ko wo panye no. Na no the beboa ama yetumi apam yare ifri yemaimu. Anyame na keja ochi na ni bane. Many ebu corona chofa. Good night and God bless you all.